What's up, guys? Today I'm going to be interviewing Dr. Andrew Choi. Welcome, Andrew.
Thank you, thank you. What's up, Sammy?
Doing well. And the purpose of today's interview is just going to get an idea of how Andrew is dealing with the coronavirus, the COVID-19 crisis, talking a little bit about what's the future of dentistry for new grads and for people in his position. And we'll talk a little bit about work and go from there. Okay, so I think, Andrew, the best place to start is to give everyone an idea of who you are, your background, what school you go to, and where you're at right now.
All right. So my name's Andrew Choi, and I have a very unique background. I grew up in Southern California. I went to college here. I went to San Diego, UC San Diego. Worked after for a while, and basically changed careers. And I went back. I wanted to go into dentistry, and somehow, it's a long story, so I'll just do it short. I just went to the Philippines for dental school, came back, did a 2-year advanced standing program or international dental program at University of Colorado. Finished that in December 2019. It's April now, so yeah, I practiced about 3 days, and then I got that coronavirus California CDA announcement. So actually it was my second day, because the first day was like my trial day. So second day was the day I heard about the CDA announcement, and I decided to. I actually had an option. I decided to not work. Yeah.
Okay. I know because I follow your account, and I'll post Dr. Andrew's Instagram link, as well as I believe you're starting a YouTube channel. I'll post all the information in my description below. But I also know that your dad is a dentist down in San Diego area. San Diego County, is that where it is? Riverside area. So the job that you're talking about, is it with your dad, or was it with a corporate job? Or
Yeah, so I work with my dad. I help a lot of his management and the business side of dentistry right now. The practice is fairly small, or really small actually. So I'm planning to do about a day a week there. But my more of a full-time job is with it's like a private group. I would say basically it's a DSO size. They have about 7-8 practices. They're growing pretty fast. So until it was the COVID. So yeah, so I'm working there right now, or I'm going to start working there next week. They actually want me back. So.
Have they given you a time frame about when they're going to go back to work?
Yes, so they've actually been open throughout the whole thing. So they've been open throughout the whole thing, and they've been seeing normal hours, and then they started seeing more of the emergency cases and urgent cases, and I think they're going back to the normal now. So next week, this coming Monday, I'm going to be going back and doing normal procedures.
So that's where it gets a little bit complicated, because there's different camps or different philosophies, I think. There's some people, I would say, for example, a lot of the hygienists out there that are totally against going back to work, because they are scared about the coronavirus and whether we have appropriate safety precautions in our practices. And there's, I think, some dentists that fall in that camp too.
Yeah.
And then there's people who are on the other spectrum that think, no harm, no foul. We can get started normal, no changes. What's your overall opinion about, I guess, the crisis and how it affects dentistry? What do you think will happen in the future? I know it's a big question, so
yeah, it's a very big question, very complicated question. I think everyone has their own opinions. My opinion is, honestly, it depends on where you're at. Initially, I was, I thought California or the U.S. in general will be able to. I was hopeful that they'll be able to kind of control this as soon, fast, and quarantine would take its effect and really lower the number of infection and whatnot. But honestly, I'm not seeing that in the near future. I think eventually, or pretty soon, we're going to have to just go back to normal hours, take the precautions, maybe even take extra precautions, and we have to start seeing patients, or else it's just economically and business wise, and just seeing the future of the trend that's going. I don't see it. I don't see this being controlled more than it is anytime soon. Yeah.
Yeah,
So
I mean, I totally agree. I think, I think we have an obligation to our patients who, you know, it's hard. We've been out of practice for about a month and a half, and now we're starting to see a lot of complications,
yeah,
And I know that they're allowing emergency treatment, but at some point we have to treat these, cavities are cavities. They're not going to slow down if it's in the dentin. It has a certain rate of, of it getting to a point where it becomes something bigger, like a root canal or an extraction. But I also do see the point where there are a lot of people that want extra safety precautions. At our practice, some of the things that we've just decided on, maybe even like yesterday / this morning, we are going to be getting some air filtration systems. There's a variety of them on the market, and I'm not sponsored by any of these companies. It's just I'm learning as we go, and the information might change next week. But we're getting 2 IQ Air systems, which is an air purification system, and then we're going to do a PureVac system for the hygienist, which is like an attachment that goes onto the HiVac that eliminates the aerosolization when they're working with Cavitron or a piezo machine. And then we're going to do the basic protocols, trying to keep people in their car, so that when they come in, they go straight to the room. We expect to maybe have not as many patients and hopefully longer procedures, meaning that if someone has a variety of work that needs to be done, maybe try to get it done that entire appointment. Maybe have a schedule a 3-hour appointment, depending on if the patient can tolerate that long of an appointment. So these are some of the things that my mom, who's also a dentist, and I and my wife, who's a dentist, we talk about every day. I think there's a balance. We want to make sure our staff is safe. We want to make sure our patients are safe. But I also think we need to get back to treating our community. So kind of that's my position. Do you have any thoughts on implementing certain protocols moving forward?
We're basically doing very similar things to you. We have extra high vacuum that we're going to have attachments to, and for the aerosol, production of aerosol. We're also doing a new check-in protocol so that patients can check in so they get to the parking lot, text us, calls us, and then we are trying to reduce patient-to-patient interaction. We're trying to also reduce people. We're asking our patients not to come with a lot of people. We're actually asking them to come by themselves if they can, unless it's really absolutely necessary. We also have air filtration system, medical grade, running throughout the whole time. And I think it's just an extra PPE for all the workers for sure. And I think it's just important to communicate that with our patients and just let them know that honestly, dentistry has gone through a lot through history, and we've always worked with some kind of an infection, and we always used protocols to reduce that. It's always been going on. Definitely coronavirus is something new and something of an unknown. That's what's scaring everybody and there's causing fear. But every day dentists work with a lot of aerosol, and they've been working with it throughout history. That it's the same thing. It's the same thing. We just gotta do things extra to take precautions for sure, though.
Yeah, no, I totally agree. I think the coronavirus is going to be here for a while, and we just have to do everything we can to prevent and keep people safe and prevent people from getting sick. But in my opinion, and I might get backlash when people watch this video, but I think we have to go back to work. I think we have to figure it out. We have to treat our community, and we have to do it safely. Mm-hmm. And I know it's a polarizing topic because there are people that say, no, like, too scared, I don't want to work. And I get that. But, so that's my belief. And I think moving forward, it's going to be interesting because there's a lot of team members that I think fear runs rampant. Mm-hmm. And then when you have a bunch of fearful people together, now it becomes elevated. Mm-hmm. And so I think as leaders of the practice, or for us as doctors and our owner docs, you have to instill confidence. You have to make sure you instill safety measures so that your team knows that you're doing everything you can to take care of them. And I think they'll appreciate that too. So that's my look up on the coronavirus. But we'll get back into more coronavirus things in the future of this interview. But I wanted to ask you, I wrote down a list of questions to keep me on track. Mm-hmm. So I know you're a new grad, and I think that's what makes you a little bit more unique in the dental space, and you're also an international student. How do you think COVID-19 is going to affect the fourth-year dental students right now? How is it going to affect their future? Should they be going into AGD GPR programs during this time? What do you think about new grads in dentistry right now?
Yeah, I mean, definitely I feel for the new grad fourth years because my friends, they're not even having their graduation. They're doing like a virtual graduation. That's too bad. It's a big life event. And so, I'm sure it's been tough for them. And in my personal opinion, COVID-19 definitely, I think, will affect fourth years coming out because just timing itself right now, it's like, they're graduating this week, and it's hitting us right now. And they're going to be in job market maybe 1 or 2 months later when we're basically restarting everything. It's going to be tough, I think, in my opinion, that to get job market will definitely reduce, especially in the private sector. If you're trying to go into private practice, a lot of small business owners, small dental practice owners won't be able to produce enough patients for the associates, even if they hire them. They might not have enough cash flow. So their options, I think, I think there's always going to be jobs, but their options, their benefits, their pay, I think will be affected. In terms of AGD, GPR, I always thought it's good to go to GPR, AGD. If I was if I was the traditional dental student, I definitely would look into GPR, AGD. I think they're a great deal. Like doing a year after dental school in a hospital setting or whatever setting, if you do more education, is always a great choice. And I think it's really necessary. I think as a new dentist, like when you are making your own decisions after dental school, when you're put into a private practice, corporate office, or what AGD, you get to practice making your own decisions. And I think that's very big. That's what I noticed when I first started. I'm still new, but the first few days of practicing, like when I was in dental school, I was very confident, that's because you have something to fall back on, you got that faculty right behind you, but I thought it was all me. I was like, oh man, in clinics, I always thought, I was like, oh yeah, man, I think I'm going to handle this pretty well. But when I was sitting there the first few days, making my own decisions, looking at the x-rays, and you start to second guess yourself, you're like, is that what it is? And you're trying to look back and try to, find somebody's F, but you don't have that. So that kind of stuff is tough, So I think the AGD, GPR, whatever, military, hospital dentistry, going into a rural community with mentors and, that kind of stuff will definitely be helpful. And I would recommend it, although I've never tried it, but I think it would have helped me a lot as a new dentist.
Well, I would say this, as a dentist who's about 4 years out of school, it's going to be incredibly difficult for the first 2 years. And that's a good thing that it's difficult for you, because that means that you're critically thinking. You're not making decisions and so confident in your decisions. The more confident you are, the probably, in my opinion, the more stupid of a doctor you are. You want to be questioning everything you do. That means you're thinking critically. Should I be? What's the best option? And eventually, I think you'll realize, at least from my experience out of school, we try to be so conservative to the point where we're doing a lot of hero dentistry. And you can be the most technically sound dentist, and you can do the most perfect core buildup and all that kind of stuff, root canal, and the tooth breaks. Mm-hmm. And it hurts, it breaks your spirit, and the patients aren't happy, even though you're doing the best dentistry that you can. But so yeah, that's going to continue for a couple years for you, Andrew, but you'll be fine. Just don't let it break. Don't quit. Just, you got to get past that barrier. But I think the first couple years out of dentistry is incredibly difficult. And it's hard. So
Yeah.
either way, but you did mention that, you were saying private practices are going to be less likely, in your opinion, private practices are going to be less likely to, number one, hire new grads, number two, maybe reduce the pay of new grads in order to be able to have them work with them. Do you think there's going to be more of a trend towards these dental service organizations / corporate dentistry moving forward? Are they more powerful now because they have so many clinics and they see a higher volume of patients than private practice does?
Yeah, I mean, I'm no expert, but I'm pretty involved, and I read a lot of things that dentists are talking about, and it seems like corporate offices, DSOs are already taking steps, and I've seen posts of dentists showing like the offers that DSOs are already giving them, like if you're having trouble, we can buy your office for you, that kind of stuff. I'm already seeing that, and so they're already taking steps and measures because they got the cash, they got the money, they have the backing for that. So I think, man, this is going to be another. It works in favor for corporate offices or PSOs, I think.
Yeah,
so,
I think I would agree with that too. Just because they have so much cash flow and I mean, this is not true of all DSO corporate offices, and I do work at a corporate style office part-time, but it's definitely more production focused, less patient centric, and they have a much higher volume of patients because they can afford to do a more massive amount of marketing. So I think so, but who knows? But yeah, I agree with you. Okay, let's see. Do you have any advice for these new grads to make themselves more appealing when searching for a job? I mean, how did you go about the process of finding a job, and how did you, I guess, make yourself stand out, or was that even necessary to make yourself stand out?
Yeah, I mean, I think it all starts in dental school. You have to really, you can never relax in dental school. I think it's a lot of dental students, I think, whenever they can, they find time to relax, but I think they'll be hit later on. Dental school is, I think, fairly easy, there's definitely difficult areas, but clinically, the requirements and stuff like that, I thought were definitely doable. You have to push yourself, but I always think you have to do extra. You have to learn more. You have to build your portfolio, take a lot of clinical photos when you're in dental school. I got this advice from, I don't know if you know Implant Ninja. He said, create a website, put a portfolio up, start making building your rapport online. And that will help you later on, even in terms of like Google Analytics, just having that website running for a while and posting your pictures and even putting up your resume online. And, clinical skill is essential. So you have to really do as much as you can in dental school and do whatever they throw at you. And I think one thing I learned while I was in dental school is I used to always try to find like, the sexy stuff to do. Like I always wanted to look at implant restorations and implants. But now that I'm in the dental space doing clinical stuff, I realize how important it is to get that practice with the fundamental bread and butter stuff, doing the fillings fast and, efficiently, and working efficiently with crowns and, working with different types of crowns. You want to be, prepping for gold crowns, zirconia crowns, whatever it is. You got to do a different variety of things and really get those fundamentals down. If I was to do it over again, I would definitely do that instead of, I had great experience. I used to follow cross faculty around and do more of the difficult cases, but that's going to come down the road for me anyway. If I really was interested, I can do that later. But I wish I would practice more of the fundamental things and think of do a lot of the critical thinking.
How did you go about finding the job that you work at currently? Were you did you use like Indeed, Craigslist, or word of mouth, dental societies? What were you doing during the application to your job, I guess?
Yeah, it started really early, like the last semester of dental school. I would Indeed, the Monster, whatever, all the websites. I used to go on LinkedIn, make a portfolio, work on your LinkedIn portfolio, profile, and communicate. reach out to everybody that you can, whatever link. A lot of the private practices wanted me to have the license first before talking to them. Well, a lot of the corporate office will talk to you no matter where you are in dental school. And so I did that early on, and I think it's also important which location you're going to. So you're kind of limited unless you're willing to go anywhere or you have a lot of different areas to go to. I always wanted to come back home, and I live in a suburban area. Riverside's not too urban, so there's limited places I can go, within the mileage. So within that mile, I was looking everywhere, man. Private practice, DSO, whatever. I just wanted to talk to as many people as possible. Visiting is very important. And talking to them and shadowing actually is also important. I would recommend that.
How many well, I guess I'll ask you two questions. I'm actually doing a lecture for my alma mater at UCLA, talking about the first 5 years out of dental school and things that can help you be successful. And I'm creating a lecture as well. And one of them, I forgot what I was going to say. I want to know, how many applications did you send out? And how many working interviews? Or was it just one working interview and it's like, we're good? Or did you do a variety?
Location took a big part for me. It was pretty limited in the areas I could go to. I did a lot of the big corporate offices. I did interview at the big ones like Western and Pacific Dental and whatnot. So I checked those out. Private practices, because I am planning to work with my dad in Riverside area. So I was limited in the places I can talk to because I didn't want to go to an office in Riverside. Although I knew they're not going to accept me honestly. So I thought. Corporate or I was also interested in looking at how DSOs work, and I was interested in seeing their management practice and stuff like that. So a private multi-practice was kind of my target goal. So I would look at a lot of different areas surrounding my neighborhood, and that's how I kind of came up with the place I applied to and did a work interview for, and going to the actual office was really important for me, and seeing for a half a day, shadowing and seeing what kind of procedures they're doing was important for me. And it kind of, you kind of pick it up pretty quick and see how they work.
Is this an office that, typically when an office hires a new grad, you're not going to be seeing a lot of the more demanding cases? Is this true for you, or what type of procedures are you currently performing?
That's also important too, I think. I think one of the things I looked at was I wanted to go to an office where they assign you the patient instead of patient moving around to different doctors. The office that I am working at, the DSO that I'm working at, is they assign you the patient, and you get to do whatever you feel confident in doing or you're capable of doing, and you are free to refer out whatever you cannot do. So I think that's important because I've heard of friends and colleagues who tell me they're often going into a practice where the patient, all the complex cases or the productive stuff are going to another dentist, and they're kind of doing the fillings and whatnot and cleanings and stuff like that, even cleaning. So that's definitely something you should ask about and ask a lot of questions when you're interviewing.
What about mentorship in this style office? Do you have, of course your father is going to be, I would imagine, your biggest mentor. That's my biggest mentor, my mother, and what she's taught me is far exceeds within a month what dental school taught me in 4 years. Yeah. But does your current office give you that mentorship, or is it more just you're kind of on your own, you just, or are you able to ask questions, or how does that go?
So far, I've only been there 2 days, but so far...
That's true. I'm asking it like you've been there forever. Sorry. But I guess so far...
I've already kind of, seen the culture of it. quite honestly, it's tougher than it sounds because in a big office like that, everyone's busy. Everyone's busy seeing their patients, and you might be able to catch them, um, and ask questions. But when you're in it, and you're making your decisions, I think it would be tough for me to ask questions and in between patients. They might be seeing patients. I can't be like, excuse me,
Yep.
It's not like a faculty, So
Yep.
it's been tough, man. The mentorship is what I find. I actually find it with my dad. I text him questions, and I call him.
Oh yeah.
So I got that lifeline.
Yeah.
So that's been helpful. But if you don't have it, honestly, I think it'd be tough. If I can't imagine like not having someone to ask questions for. So I think having a mentor, before you start is also a big thing.
Yeah, I think that's very true, and I think we're in a lucky position that we have parents that have done 30 plus years of dentistry that can kind of guide us, and we can guide them on new dentistry. But I think mentorship comes with very small private practices. The way I look at choosing a practice is it's hard because we have so much debt coming out of dental school. Over 250 in some cases, some people $500,000 of debt. But the way I look at it is if you choose a small private practice, the value is in hopefully the mentorship. That one-on-one interaction with another doctor who can guide you through certain complicated cases and things like that. But typically, from my experience and from those around me, all of my colleagues, these small practices, the pay is going to be minimal. Which is that right? Yeah, kind of, because you're not seeing that many cases, and that's what they can afford. Then the bigger practices, typically you don't have time to do anything other than do the work, and you barely get a lunch. So you're kind of moving at lightning speed. Is that wrong? No, not necessarily. If you're skilled enough to go at that speed, and then you get paid a little bit more to do that, then I think that's okay too. So I don't know. Everyone's different, but I think people that are new grads have to make that decision. Do you want that mentorship? Do you have it right now? Do you need it? Do you want like a dentist there that can guide you? Because that mentorship can be valued above anything else, depending on if you have someone who can really walk you through not just technical dentistry, but leadership skills, talking to staff, talking to team, how do you interact with people, handling stress, communication, which is probably the hardest thing in dentistry. I used to think I'm a great communicator. I can talk to anyone. And then I realized once I do dentistry that I'm nowhere near where I need to be, because you're dealing with complicated cases, things that sometimes for no fault of your own can go wrong. And how do you handle that situation? So, so that's how I look at it. What would you say to a person who doesn't have a family member who's a dentist? I mean, it's a hard question. I guess it depends person to person. How would you respond to it? Let's say you have a friend that comes out, hey, Andrew, I don't have a mentor, and I want to get into practice. I have a lot of debt. What should I do? Should I do this corporate job that's paying me $300 more than this private? What would you respond?
If it's my friend, I would definitely tell him to find a practice where, it depends on his clinical skills, but if I think I would tell him to find a place, even if it's less pay, if you get that great mentorship, you got to look at the long run, and my dad actually gave me this advice. He told me, even, at the DSO, he told me don't get rushed, do things the right way, the first time, and take your time because you're going to be rushed, and I felt that already. I'm seeing 2-3 patients at a time the first day, and I was going crazy. I was about to cry. I was crying under the mask too. But he said, don't get wrapped up in it. Do the patient right the first time, and as you build that up, you'll build that speed up. And that's what I'm planning to do. And I already talked to my management staff there, and I told them, you got to communicate and be like, hey, I'm a new dentist. You guys are throwing 2-3 patients at me, but I think it'd be better for me and the patient if we, work on it a little bit slower, especially new patient, new patient treatment planning and, everything. It was tough, man. First 2 days, I was like, oh my God, how am I going to do this?
So that sounds like really sound advice. And same thing with my mother, do right by the patient. Treat the patient. I mean, we follow the fundamental principle that we're treating each one of our patients as if it was one of our own family members. So if there's a patient who's a little maybe rushed, hurried, I think of like, oh, okay, that's like my grandfather. He gets a little rushed, hurried. I have to communicate almost like he was my grandfather. If there is a person who is, overly kind, I'm like, oh, this is like my mother, and I relate each patient to a family member, and it makes it a little bit easier on me to make these decisions. And always having that, you have to do right by the patient. I mean, that's just kind of a testament of what person you are. And there are people that don't. And there's people that don't really care. Or there's people that maybe get lost in the system and they forget what it's like to treat the patient the right way. And that happens, and you can't lose that. You definitely can't. You can't lose that. So,
I think it's really important for dental students to understand. Like, I think, like you said, they get lost in that system, especially if you start at a DSO or an office that's going fast, a very fast-paced office. I think you can get lost in that system. So it's important to remember that there's not all offices are going to be like that. You can control yourself, and you can control it by like talking to the management, or you got to go with an office with a similar philosophy and culture that you want to work in the long run. So I think that's really important to look at too when you're looking at offices to work for.
Yeah, we're kind of getting to a point now that we're talking about how some offices, and I'm not against by any means DSO, corporate, anything. Who knows? I might have multiple practices in the future. So it's not an attack on any style of office. That's definitely not the case. But there's going to come a time, and you're going to notice this when you start, that you're going to start to get pushed. And there's going to be a point where you have to stand up for your beliefs and your values. And as a young dentist, I think a lot of people have a hard time pushing back. And I can tell you right now, I have pushed back, hard, to the point where they know where I stand, to the point where I said, if you can't accept this, I'm leaving right now. And you have to have that line saying who you are and what's not acceptable. So that is something that I think a lot of young dentists that are joining practices, whatever it be, it can even be a private practice that they might push you. You have to draw lines in the sand. And also, just since we're on this topic, there's also going to be people who do things a different way, the wrong way. They say, oh, you got to do this procedure this way. They skip 5 steps. Oh, what are you doing? Oh, why are you doing it that way? No, that's wrong. No, you're doing it the wrong way. And they're going to make you question, everything you've learned. Don't question yourself. You just came out of school. You know exactly how to do it the right way. And it will happen to anyone. So
you don't always get that from like another dentist. You'll get it from like a dental assistant, or because they see it some way from another doctor. They're going to be like, why is he doing like that? Especially if you're a new grad, you're going to be questioned. A lot of things are going to be questioned, especially the first few days. I'm sure you're going to be questioned a few times. So prepare for that. And you always have to educate yourself. That's the most important thing. You have to know what you're doing so that you can stand up for that. So
I would also just flip it, just to give that counter side, which is that when I first started, there were certain techniques I said I would be judgmental. And I would say, oh, this is obviously wrong. This is not the way you do it. And with more education, I realized, oh, it's not wrong. It's just another way of doing something. So you can't also be so judgmental to say, I can name like hundreds of items where I'm like, now I know this technique, I know this technique, I know this one, I know the one up here. I know there's so much out there. Eventually you got to pick one and stick with it, your dad's going to give you like one way of doing it. Someone else is going to give you another way. And then eventually you just got to do what works in your hands. That's how dentists talk. Like, this works with me. This works with the patients. I'm not getting post-operative sensitivity. Everyone's happy. Like, I'm sticking with this one. So there's that too.
Yeah.
Okay. But instead of getting hung up on this, let's do a little bit more and then we'll end the interview. But I want to talk to you, let's do, 2 things. The first thing is, how are you handling debt during this time? What's your strategy for debt? How do you look at debt? Or do you have debt? Are you one of the lucky ones?
I have debt. I have
Okay.
debt, but it's like more of a personal family debt. So
Yeah.
I'm luckier. I'm luckier. My debt doesn't have interest, which is a big thing. So, but
Yeah.
I do have a debt payment to make, and I do have to kind of worry about that. So I understand how it feels. For me, it, yeah, like I mentioned, it's a little different from other people. But I look at debt. I've always followed the philosophy of debt isn't always bad, and I like to try to learn more on how to leverage debt. I feel like that's how wealthy people think. That's what I've read, in books. So there's different philosophies on debt. I've heard like Dave Ramsey kind of thing where they're like, oh, all debt is bad. And I've
Yeah.
heard about, like, I think it was a dental student or a medical student that called in. He's like, don't go to dental school, like that debt is ridiculous.
That was
Like,
no,
it's
that was the
not.
one. He also had one where he said like the dental student was like, "I have $450,000 a day." He's like, "No, you don't. You're lying." Remember that one? I
Yeah.
was like, "No, dude, you have no clue."
You have no idea what's going on. But yeah, that you have to, it depends on your personality and like your philosophy, man. But I'm kind of far from Dave Ramsey. I've heard of a lot of different type of philosophies. I'm more on the, I think leveraging debt. You have to be careful, of course, and you have to be calculating everything out and make sure you are measuring. But I never think that debt is bad. You have to leverage it. And so my way of thinking about that is that I'm actually going to go. I'm sure I'm going to go more in debt because I'm looking to go buy a private practice pretty soon, like within the next year or two. So I have more coming. So I'm not that afraid, or I don't really think about it too much. It's just part of it, part of life as a dentist. It comes, and you just have to work hard and be educated and get the right team or support system around you that can give you sound advice on it.
Yeah. No, I totally agree. I'm not. Well, there's a lot of different camps. There's some people. So let's imagine we have someone who does have debt from the government. High interest rates. I'm just going to talk a little bit about it.
Mm-hmm.
The main thing is the interest rate is super high. If you can manage that to a lower interest rate and then you can take your money and invest it somewhere else, that will be better. And always put investment in yourself, whether that be buying a private practice or educational courses and stuff like that. I definitely believe that. Refinancing. So if someone has a 5% interest on their government loans, refinancing is always an option to get, so you're paying less. I'm not of the belief personally that you have to pay it all off immediately. I would rather take that money and invest it like what we're doing right now, investing it in a practice. And let's see, what else can we talk about? That living below your means, just don't be stupid. There's so many people out there that go and, they exit dental school. Oh, we did it. Oh, I'm going to drive this. I'm going to do this. It's like, no, like live below your means. Like you're not, you're actually a negative, you have no money. Like if you think
Yeah.
about it, but I think that's a little bit about, I don't know. I think to be honest, a lot of my friends, and maybe
Yeah.
this is just my friend group, but we all manage our debt well. We don't buy expensive things. We have the same cars that we had back in high school, and we don't, and we're pretty smart about it. Now, a couple other things I should just mention. The federal government, everyone knows this, but they put the interest at zero, so a lot of people that can hold on to it, without paying any interest. And Steve Mnuchin, he just said recently that he doesn't plan on raising the Fed. What's it called? I don't know what it's called, but he's not raising the interest anytime soon. So we'll see what happens. I don't know, and I also don't know if you have government loans, whether this election cycle they're gonna start talking about that. Is there going to be some type of forgiveness available? It wouldn't apply to me because I've already refinanced my loans, but maybe to some of these new grads, maybe there is some type of forgiveness. I'm not really sure.
There's a lot of talk on that. Yeah.
I think it's going to be a big. Personally, my prediction is going to be a big. It's either this election cycle or next election cycle. They're going to try to solve it because it applies to so many people now, like from 35 to 18. So we'll see what happens. Okay, I think we should end it on I really liked, I mean, I could go on forever about search engine optimization, YouTube, about putting yourself online. I mean, I could go on forever. I think it's incredibly important. And I do know that you have created a YouTube channel, and I think that's the smartest thing you could do. I think YouTube is beyond any other social media platform because it's a search engine platform, just like Google, and it probably will exceed Google, even though they're the same company. So kudos to you. And the way I look at branding coming straight out of school is you want to position yourself for when you have a practice. And the more exposure that you can start, even if it does nothing, just the more exposure you can put yourself online, you know, or Instagram or TikTok or whatever, when you have a practice, that can actually translate to people seeing you, seeing how you communicate, relating to you, and possibly choosing you as their dental provider. So I love it. What are your thoughts about branding?
For me, like starting Instagram and YouTube, all this stuff, like, you know, like Google, like SEO, all that, it's all a learning process for me. So I just do it because I learn by doing. I just throw myself in there, mess with around stuff and see the results, see what people like, what kind of posts people like. You know, all this stuff is all a learning process for me. You know, especially in the beginning, you just play around and see, you know, what people like and how do you get more likes? How do you get more followers? And I love Instagram and social media because you have to meet people. I met you through social media.
Yeah.
I met so many different people from social media that give me, you know, like I grow. I grow by learning from them. A lot of people have that abundance mentality and they're ready to share everything with you. So I think just from that, it's worth it. And, you know, branding, you know, I didn't really think about it too seriously until very recently. And, you know, I used to think like, what am I branding? I don't understand, you know, like I'm not a brand, you know, that kind of stuff. But, and I used to never think, you know, who would follow me? I'm not that interesting, but, you know, you'd be surprised when you start putting stuff out there, you know, people are interested. People want to find someone like you. So, and you want to find people like yourself too. So it's a great learning experience for me, and I learned a lot through everything. So I would highly suggest that everybody post stuff, and it's a good experience, man. Like I used to be very fearful of public speaking, although like camera speaking is also, I was fearful of it. But once you start doing it, it's, you know, it's no biggie.
So, what do you think about people? First of all, yeah, talking in front of a camera is incredibly difficult.
So weird.
It's so weird. It's very difficult. It's not easy. There's nothing easy. Dentistry's not easy. Doing YouTube videos, Instagram videos, nothing's easy. So it's definitely hard. But what about the person who is a bit on the shyer side and understands the value of branding or posting stuff? What can that person do to stand out or to help their possible future practice?
I think being interested in other people, like I think for me, I mean, I was on the shyer side too, and I think Instagram, like putting video out really helped me build confidence, and I was like, oh, people are following me, you know, I might have something to share. You know, you have to look at things that you can help other people out, you can interact. And if you're shy, just, you know, start small, take baby steps, take smaller steps, and you'll build that confidence once you realize, you know, you're more interesting than you thought. So that's, you know, I think you just have to do it. You just have to do it. There's no other way around it. There's no, you know.
Yeah, I think the way I look at it, and then we'll end after this. Two things. I think number one, dentistry is trending to more transparency. We no longer live in a world where someone goes onto the website and says, "Oh man, I really like that staff picture. I'm going to go to that doctor. Awesome. Yeah." No, like that's not a real thing. I think people want to see your work. I think people are more educated. I believe in the general population education is increasing at an exponential rate. So people know what's going on. They know what conservative dentistry is to some degree. They know what aggressive dentistry is to some degree. And then they don't know a lot also, you know, and we have to educate them. But I just think dentistry is trending towards that. So you have to, the more you can educate the population, whether it be through dental photography, whether it be through explaining procedures or your thought process about procedures, I think people would be more inclined to go to that person who's explaining, who's talking about their passion so that they can relate to this person and they can maybe learn from this person than someone who doesn't say anything and has no presence. And also in terms of transparency, I think maybe in 50 years or so, like I might be a little crazy, but I think people will have a video recorded of the entire procedure. Like that's going to be mandatory. Like I'm talking about 50 years from now. Like, oh, I'm getting a cavity done. Oh yeah, I went to my doctor. He sent me the video file. You know what I'm saying? Because it's just way more transparent. So that's how I look at it. So I think it's incredibly important. And if you're a new grad, you got to get into it and you got to figure it out. And learning how to shoot video, I'm not a video person. That wasn't my major. I learned over a long period of time and watching tons of YouTube videos. Dental photography, I took some awesome photography shots. I never picked up a camera until after dental school. And then I just took lots of photos. I tried to do 1 photo a day in clinical practice. And the first year was just horrible. And then eventually you figure it out, you know? You figure out about the setup, lighting, cameras, all these specs. And then you become your own, like, what's it called? The person who does camera and lighting. What's it? Whatever. There's a term for it. But yeah, so that's my opinion. So either way, Andrew, are there any other questions that you have for me, or is there any topics that we need to talk about?
Yeah, I actually came up with some questions I was going to ask you. Like you talked about like communication with patients. Do you have any recommendations on who could you know, any books or videos or whatnot? How'd you learn? How'd you learn to talk to patients?
To be honest, my mother is a master communicator. Just, you know, like I thought I was good. I really did. And I realized I'm like 1 out of 10. Like I have a long way to go. I learned from watching my mother. So it goes, I guess the best way to do it is to go to a really nice practice that has, you know, great reviews, patients that have been with a certain practice member for a long time, and just watch and mimic. And then eventually you have to find your own voice. One of the biggest challenges I had was I was trying to mimic, you know, my mother, who I believe is just an amazing dentist. She is an amazing dentist. But eventually when you mimic someone else, it's hard on you. You're not happy. You know what I'm saying? So I'm my own person. When I talk to people, in general, I like to joke around. I like to dish it and get it back. And that's who I am. And I have to find a way to merge that in my practice, because that's true to who I am. So you can't be someone who you're not. That's number one. Number two, you have to learn how to listen. Listening is one of the hardest things to do, to shut up and listen. In terms of books, yeah, there's a variety of books out there. But I can't think of them right now. I'll see if I can put... I always listen to like audiobooks and stuff like that. And communication, like self-help books. If I'm going to read a book, I'm typically not reading a fiction novel. I'm reading like a self-help book. That's just who I am. So find communication books that help you empathize with people, and I'll see if I have any recommendations. Do you have any books that you could recommend?
Yeah, so very recently I have this book right here. We're implementing this into our practice. I don't know if you know Dr. Homily. Do you know Homily?
No, but I think I saw this on your story, I think.
Yeah, so I started reading his book, and then he has like an online course, you know, and I kind of took it, and I think it's good. It's just he has a system of how to, you know, greet the patient to what kind of stuff you should be talking about. So that's been helpful for our practice, I think. So far, we're just starting to implement it, but yeah, I would recommend it. I would recommend it to anybody that's interested in learning about communication.
Yeah, another challenge, since you brought that book, that's kind of like a practice management book. Another challenge for a lot of dentists is delivering not so flattering news, you know? Like you're doing the treatment exam and you're like, man, he's got like 10 cavities. How am I going to relay this to my patient in a way that's confident and without like, in a way that's acceptable? And that's another one of the biggest challenges you can do. Because at the beginning, you know, there's all this cavities out, and I would say, yeah, you have all these cavities. And the patient would say back to me, "Oh, doctor, like I didn't have it before." I say, "Oh, well, you do. I mean, it's up to you. Whatever you want to do. Okay, I'll see you later." Get out of the door. Okay, doctor,
Yeah.
thanks so much. But are you really doing a service to that patient by not, I guess, illustrating how important it is to treat? Now, the problem is that there's dentists that are doing over-aggressive treatment and that patients are getting screwed over, and then they have this bad reception of dentistry as a whole. So that's the battle.
Yeah.
But I think if you truly are empathetic and you don't want to just give up. Hey, you need a crown. This tooth is cracked and da da da. Oh, I don't want to do it. Okay, bye. You can't do that. You have to really illustrate the importance of why it needs to be done.
Mm-hmm.
And I don't really have a clear answer to how you do that. You just have to.
Yeah.
I don't have a clear answer. It's hard.
Yeah.
It's
I think
very
it's
challenging.
I think it's important to listen to the patient's concern too. Like you have to. We have this system that we learn in dental school. Like we have to tell them everything, and we do have to tell them everything, but we do it in a systematic way that's taught in dental school. But I think it's important to, when you're in a practical setting, listen to what they're concerned about first, help them figure out and find that solution for them. And then we can definitely, we tell them everything else, but we have to listen to what they want to do, because that's why they're there. That's their number one concern. So we can't always be like, you got gingivitis, we got to do this first and make sure your periodontal disease is all taken care of before, dental school, that's how they teach you,
Yeah,
So,
you hit it on the money.
yeah.
Listening is like, it sounds such like a trivial topic, but it's one of the hardest things that you're going to be learning for, the next 33 years of your life. You're going to continue to be a better listener. You have to, you're right, listen to the patient, find out what their chief concern is, and then you wrap the treatment plan around that chief concern.
Yes.
So that's another challenging topic.
Another topic for sure, a big topic.
Yeah. Any other questions, or I think we talked about a lot of different things. Hopefully some people find value in this. I don't know.
It was fun. I there's so much more to talk about. We should do this more often, man.
Absolutely, man. And I know you're close by, so maybe we'll do a meetup sometime. Why don't you just what's your plan for your YouTube channel in the future? What do you want to do with that platform?
Honestly, I'm not sure yet. I have a little bit of a goal. Like, I don't want to do just all dentistry. I would like to be. I would like my target audience to be a little more broad. I'm trying to figure that out right now. But like all my interest stuff, like with Instagram, I started out just posting videos. So I'm like making videos of anything, just filming anything, and I'm gonna throw it out and see if people are interested. And we'll see where it goes. But
What's the name? What's the name of the channel?
It's just my name, Dr. Andrew Choi.
Dr. Andrew Choi, and that's also your Instagram as well, correct?
Yes, that's correct. So yeah, come check me out.
Well, man, I think that was a great interview. It's a pleasure to I think this is the first time we've actually talked kind of through a computer screen, FaceTime, whatever. So yeah, I love your content. I think it's really interesting. I don't post on Instagram that often because there's so much social media out. It's hard to do it all. But for those of you that are, I guess, new grads, new dentists, or even dentists of 33 years, follow Dr. Andrew Choi. He gives honest account of his life, and I think that's really important. You're very genuine, and hopefully we can do an interview in the future.
All right, enjoy this, Sammy.